Okay, so first of all, hello everyone and welcome. We're so glad to have everyone here with us this afternoon. This group is part of an early CuroNow waitlist community, and that means something. That means that this is truly the first, you are or truly the first to shape what this caregiver platform becomes. So thank you for taking the time for being with us. Today we're joined by someone we deeply admire, and that's you, Dr. Angie Ingraham. Angie is a board certified patient advocate. And before that, she spent many years as a surgeon and ICU physician. She brings such a unique and compassionate lens to supporting families through complicated medical situations. Before we dive in, just a quick housekeeping note. We're recording the session so we can share it later with the early community. Because we have a very small group here today, your audio may be enabled. I can see that you guys are not right now, but please feel free to use the Q&A chat if you're more comfortable. I don't think any of you are shy, and we'll have plenty of time for questions toward the end. So let me just give a 1-minute context about CuroNow. At CuroNow, our mission is simple but powerful. Support caregivers and strengthen families. Many of us on this call today know firsthand how overwhelming caregiving can be and how alone it can feel. CuroNow exists to make caregiving more connected, less chaotic, and a little more supported. And part of that commitment is bringing in experts like Angie to share real tools and guidance that families can put into action right away. So with that, I am delighted to hand it over to Angie, who's going to walk us through what independent patient advocacy is, who it helps, and how families can access this kind of support. So Angie, the floor is all yours.
Awesome. And thanks to you both for the invitation to come and speak to you and to interact with your users. And I'm really excited to tell you more about independent patient advocacy. And if you can go to the next slide, Pat, that'd be great. So just an overview over the next kind of 15 minutes or so. I'll walk you through what independent patient advocacy is, who can benefit from advocacy services, and then give you some tools on how to find an advocate that can meet your needs and work with you. I want this to be interactive, especially since we have such a small group. So please come off mute, interrupt me, ask questions. We'll have plenty of time also at the end if you want to hold your questions. But I love interacting with people when I talk and not just talking to a screen. So you can go to the next slide, Pat. So again, just a little bit about me. I am a licensed and board certified surgeon and ICU doctor. So I still hold my medical license, although I don't see patients clinically anymore. I stopped seeing patients about 2 years ago. I am also a board certified patient advocate. I'll talk a little bit more about that and what that means a little bit later. But it's most important, especially because I do have a physician background, that as an advocate, I don't serve as a physician to my clients. I'm truly there in my advocate role. And most advocates are not physicians, and we'll go through their most backgrounds in a little bit as well. I got interested in advocacy due to the struggles that I had with my father's brain cancer diagnosis. So Pat, you can go to the next slide. So this is a picture of my dad and me. He was 69, essentially otherwise healthy when he was diagnosed with glioblastoma, which is aggressive brain cancer. And he did ultimately pass from that after about a 5-month or so illness. And we just found that he got different care because he had me by his side, because I knew how the system worked, because I had connections. And I've included a sample list here of just some of the advocacy kind of services or the advocacy role that I played with for my dad during his illness. So it was, identifying his surgeons. We ended up getting three different opinions from 3 different chairs of neurosurgery, actually, on what we're going to do for him and treating him. Helping him develop questions for them, going with him to doctor's appointments, coordinating all the appointments and the scans and everything that he needed. Helping with transportation, especially at one point where he did need to use a wheelchair. And so getting him transportation to those appointments from our home. Lots of transitions of care. So he had a somewhat complicated course went from the hospital to rehab to home, back to the hospital. So really trying to be there and smoothing those transitions so that as he moved from one location to another, the teams really knew kind of what was going on and everybody was on the same page. We did appeal insurance. So he actually, the day before he had an MRI scheduled, which was the day before his surgery, we got a call saying that we didn't have prior authorization, and so they were canceling his scan. And so we worked to get his scan scheduled or get that approved so that he could actually have the surgery that was scheduled. And then organizing home health and home care, because we were fortunate, we had some resources. We were able to keep him throughout his course at home when he wasn't in an acute hospital or an acute rehab situation, but we couldn't have done that without additional support. So that just gives you a little bit of flavor of what some of the advocacy services advocates can provide, and a little bit more background about me and kind of how I got interested in this profession. Pat, if you can go to the next slide. So one of the organizations, the professional organizations in patient advocacy is CuroNow, which is the Coalition of Healthcare Advocacy Organizations, and they did a survey, and because they were trying to find, okay, like what is patient advocacy? And so you can see in this figure, it really is a range of services, and any advocate then is trying to provide the services that clients and families need so that they have resources, information, education, and support when navigating their health. But health is really, truly broadly defined. So it can be anything from helping them navigate within a hospital all the way to how do I help someone age at home. So I think we tend to think about healthcare advocacy as being very medical or clinic or hospital driven, but it really expands well beyond that as well. You can go to the next slide, Pat. So as far as independent patient advocacy, I tend to bucket it, although it is on a continuum, into two groups. So one is kind of clinical or healthcare navigation, and the other is insurance and billing advocacy. There are some advocates that all that they do, and not just saying all that they do, but their focus is insurance and billing. They actually don't do anything related to going to appointments or setting up appointments. They're the ones that I would actually call on if you had a $300,000 hospital bill that you're trying to negotiate down, because there are people that are very specific and well versed in that arena, and can serve clients in that way. As I mentioned, there's a board certification for patient advocacy. There actually is not a licensure. And so because of that, I can work across the United States. So I've had clients in New York, I've had clients in Iowa, and then obviously clients I live in Madison, Wisconsin, so in the Madison or Dane County area. As I mentioned, relatively few advocates are physicians. Most come from a nursing or a physician assistant or NP background, social work, and then especially the insurance and billing advocates, a lot of them have experience in billing and coding or some kind of healthcare or senior living facility administrative role, that kind of a background. And the scope of advocates really does vary based on their expertise and their experience. And so it's not a cookie cutter where you have to have necessarily certain credentials to serve as a certain advocate. It's very somewhat defined by the advocate. What is their scope of practice? You can go to the next slide, Pat. So how are independent patient advocates unique from other advocates within the healthcare arena? So you may hear about hospital navigators or hospital advocates or insurance advocates. And I highlight here some of the main differences. So one is that I work for the client. So I'm not working for a hospital, I'm not working for a healthcare system or an insurance agency. My salary, my income, and my allegiance is solely towards the client. because I work for the client, I can then also travel with them across their continuum of care and between different healthcare systems. So I can travel with the client from their home to hospital, to rehab, to assisted living, and I'm not bound by any of those kind of situational barriers. I also, because of that, can span between healthcare systems. So I have a client now who is getting their care through one system, but they want to get second opinion at another system. So I can go across those systems because I'm not tied or employed by, for example, one healthcare system. The delivery of advocacy services also varies. So for me, if you're local to Dane County or the Madison area, and you want me to go with you to clinic appointments or to meet in person, I do that. For my New York clients, for example, it's mainly by phone or Zoom, but if they do want to fly me out to go with them to an appointment, I would do that too. That also just it varies by the advocate. There are some advocates out there who only offer virtual services, so it's very tailored to what the client needs and what the advocate decides that they want to offer as part of their services. Payment for patient advocacy is primarily private pay. There are 4 codes that have been approved by Medicare to reimburse for advocacy services. That just happened in 2024, so the implementation of that is still a little messy, and it's working with Medicare, and so it tends to be somewhat complicated. Most private independent patient advocates, there's only actually one in the country that I know of that is even starting to think about taking Medicare just because of some of the bureaucracy around it. There are also, you will find some advocacy services that are offered through like employee assistance programs. And they can do some of the things that a private independent patient advocate can do. I tend to think about those services though as somewhat kind of advocacy light, if I can say that. They tend not to be obviously in person. They tend not to be as in-depth or as comprehensive as as an independent patient advocate can provide. And with some of the more for-profit companies that are out there providing advocacy services, it is not transparent, at least, on how they're vetting the people that they're hiring and offering as advocates. So this is still a very young profession. The board for patient advocates actually was only started within the 2010s. So it's a very young and growing and evolving field. Pat, can you go to the next slide?
Sure.
So who can benefit from advocacy services? So it's really anyone who needs support navigating health or healthcare. We tend, potentially because of some elder bias, I think, tend to think that it skews more towards the elderly. But I've had a client who was in their teens because their parents were trying to figure out surgical options. I have a client now who's in his 30s. He's the one that I'm trying to find a second opinion for. So while definitely a lot of our clients do tend to be older adults, particularly solo agers, so people who, I have a client now, for example, who her husband passed away. She doesn't have any children. Her closest relative is a niece in Arizona. And so I'm helping to help her go with her to appointments, navigate the system because she has dementia. The other people who can also benefit from advocacy services are also the kind of sandwich generation. So for me, if someone is an adult child and they are hiring me to help with their adult parent who has, let's say they fell and broke their hip or something of that nature, my client technically still is the older adult, but often it's the adult child who's hiring me because they're the one that need the help and having, they're trying to have their own career, raise their kids, and take care of mom or dad. And so that's where I can come in and help offload some of that burden and help them navigate through the process. Um, Clients may or may not have a connection with the healthcare system. So, sometimes people hire a patient advocate because they don't know how the system works. They don't have someone who is a nurse or some other healthcare professional in their family. But honestly, I've had 2 clients now where one, her husband was a physician, and another, her son is a physician, and they really just want to serve as the husband or the son. They don't want to necessarily be the one who's trying to take care of all the other, logistics, or to do all the other things that are needed in helping someone navigate the system, because they really just want to show up for that person as that family member. Can you go to the next slide, Liz?
Sure.
So how do you find an advocate? So I put some links in here, and you, Pat and Rukmini, you can definitely share the slides with the group. The first is the Patient Advocate Certification Board. So that is the board that certifies patient advocates. There is a test that you take, and they have other questions in the application process as far as qualifications. And then there is a continuing education component to it. A lot of the board certification does center around the ethics and professionalism related to patient advocacy. And, it highlights that I am not making decisions for my clients. I'm helping to empower them. I'm helping to keep them informed, making sure that, especially, for example, me as a physician, I am not providing medical care. I'm really truly wearing that advocate hat. There's a whole kind of list of other ethical and professional issues that can arise in patient advocacy. There are several directories of advocates. The one I tend to direct most people to, and I think it is actually the most comprehensive, is the Greater National Advocates. GNA was actually started by Brad Schwartz, who ironically was a medical malpractice attorney in Chicago. When he got sick, he was actually admitted to a hospital with sepsis, became incredibly ill, and ended up actually having needing partial amputations of his extremities as a result. And so from that experience, he started Greater National Advocates. The irony of it is that he actually also just recently got diagnosed with a glioblastoma. He thankfully has been treated and is actually doing well from that. So that's the backstory between GNA. And then the other major professional organizations related to patient advocacy are Health Advocate X, which I actually sit on the board of and run our case reviews. So advocates can come to a Health Advocate X, and we present cases and discuss lessons learned and tips and tricks on how how advocates navigated often potentially challenging client experiences. The National Association for Healthcare Advocacy, and the Alliance of Professional Health Advocates. The Alliance also has several different educational programs. So, like, for example, when I decided to become an advocate, I took their patient advocacy boot camp, and took another course that they had on kind of starting a business as a patient advocate, because I truly wanted to take off my hat as a physician and put on my hat as a professional patient advocate. So the hyperlinks for those organizations are embedded within the icons. And so that's all I have. I can go to the next slide, Pat. It's just a general kind of questions. Happy to talk through anything. I know it's a little bit of a whirlwind, but happy to have a discussion about patient advocacy and answer anything that I didn't cover. So.
Well, Angie, thank you so much for that. That was incredibly grounding. I've seen you speak before, but that was so helpful for me. I've got a list of questions, but I want to turn it over and open up the floor first because we've been going around talking to a lot of folks at the community centers and the senior living, senior centers and the assisted living facilities lately. But I want to open up the floor first to see if you all have any questions.
Sure. That was excellent. Thank you so much. A wonderful presentation, and you do amazing work, and it's it's just wonderful. And is one of the sort of components to your advocacy is doing things like taking notes during doctor's appointments and then sharing the notes with family members. And do you also have access to, like, for example, the portal, so you can keep track of their test results, blood work results, all of that, or are there HIPAA and privacy issues with that?
Yeah, so great questions. Yeah, so a lot of what I do is taking notes at doctor's appointments, translating that, going over with the client and their families, like kind of reinforcing what was said at the appointment, sometimes decoding medical jargon if there was medical language that was used that doesn't make sense to them. So yeah, totally. A lot of it is care coordination and communication, especially when the family member is living far away or things of that nature.
Do you have do you ever ask questions during the doctor? Like, do you say, can you explain that, what that means, or do you just more listen?
It varies based on the client. So I have a meeting with my client before any appointment that we go to set a list of questions and make an agenda. My goal is to try to empower and have my client be their own best advocate, their own, self advocate as much as possible. That being said, I usually don't stay silent during the appointment.
Right.
I chime in kind of when needed. And especially sometimes, because I am there, it's sometimes redirecting the provider to address the patient, address the client, and not direct the questions at me.
Yeah, I'm sure. Yeah.
Regarding HIPAA, so technically, patient advocates are not considered a HIPAA covered entity,
Okay.
which is actually really good, because if we were, like, the regulations around HIPAA, like, we couldn't have a business. It'd be too taxing,
Yeah.
That being said, we all have, so like I have my own health information release forms that my patients, my clients sign. Usually the hospital still requires, even if I turn in my own forms, the hospital requires their own forms. The vast, and I will say, from a client or family standpoint, I tell them, I take your patient and your clinical information, your own private information very seriously. I have measures set up to protect your information. I have never had anyone not be willing to give me their portal login.
Okay, that's great.
Because that is the easiest way for me to go in, understand what's going on. I do create like a medical binder. Some of it is just to keep myself organized, but I have like I think it's now like 40 pages or something, and it's intended to be a one-stop shop for everyone's health information, because although the EMRs, the portals, are somewhat okay at talking with each other, they're not great. And they don't also include some important information there, like, especially for my older clients, I have a whole section on, like, what can you do as far as bathing and dressing? Do you need help with all these different higher level skills too? So it's also intended to be, if someone comes into to work with a new client, they can look at this one document and have a really great understanding of what's going on and what kind of support that they need.
So is it 40 pages for one client?
Yeah, depending on how long.
Okay, that's great.
Yeah, I mean, for me, and I don't know, I'm a little bit type A and I go a little bit overboard, but I have like, doctor, specialists, advanced care planning, medications,
Right.
family history, scans, it depends on, the length of it depends on how complex they are. So
Yeah, no, that's, and I think for your medical background really probably helps with you know the kinds of questions to ask, even if you're not providing medical advice, and know like what, oh yes, we need to include blood work and, stuff like
Yeah.
that.
Yeah.
Another question I had is, I'm sorry, I don't mean to ask so many questions, but do you ever have a situation where you're taking a client to a doctor's appointment and his or her family member comes to the appointment as well with you?
Oh, sure. Yeah.
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 Okay.
Yeah. Yeah. And I should clarify, so I don't drive my clients.
I was gonna ask that.
Because
I was gonna ask, yeah.
yeah, so just from an insurance liability standpoint,
Oh,
I
yeah.
don't drive them, but I will help to arrange transportation for them.
Got
And
it.
then
Yeah.
I either, if someone else is driving them, I can ride with them, or I
Right,
just
yeah.
meet them at the office. So
Well, for example, I don't drive. I don't know how to drive. We don't let my dad drive. So I take my dad to all of his doctor's appointments in an Uber. Like I'll have the
Yeah.
Uber pick me up and then pick him up and then go.
Yeah.
So
yeah.
yeah, I can see from a liability standpoint, that's good for you not to drive them.
Yeah.
Yeah. Okay. Thank you.
Thank you, Angie. I know, Andrew, you have to drop soon. So do you have any questions?
Oh, sorry.
Quite all right. I do have to drop. I do have questions, but maybe a very quick one on the point of joining for appointments. Do you ever join virtually?
Yeah. Mm-hmm. Yeah. So either like for my clients in New York, she had one where it was a virtual appointment for her. So I just joined virtually to that. If they're in person, I'll usually just get on a speakerphone.
Got it. Makes sense.
Super. All right. Thank you, Andrew.
Thank you.
I have a question, Angie,
Thank you,
now.
Angie.
And actually, I feel like this is something that everyone's talking about right now, because I feel like a lot of adult children, myself included, feel overwhelmed when trying to make long-term care decisions with my mother-in-law. My mom, there's no way she's going to ever do anything like that. So what role can an advocate play in evaluating assisted living or memory care options, navigating wait lists, deciding whether aging at home is even feasible, and how do you help families think about future living needs?
Yeah. So, as much as I I like to get involved with my clients as early as possible in the process, because some of these things take time to sort through. So if you can identify ahead of time, even if nothing has happened, if I do need a rehab facility, these are the ones that I would want to go to. Or if I, do need assisted living, I would like to go to this place. I can definitely help in that, in multiple ways, but some of it is just like, let me help you know what questions to ask them. Let me help you, also through the networking that I've done. I have a whole, kind of Rolodex now, I guess, of people from assisted livings, from home health and home care, from home modification, remodeling companies, real estate agents that specialize in downsizing, kind of if it touches the senior living space or any kind of advocacy related topic, I have a contact. And because I've been doing that networking, I know who I can trust and who I would refer my clients to as well. I think the more that can be done ahead of time, and the more that I as an advocate can help guide you through that process, the better. Because when you are in the hospital, for example, and you're trying to navigate this after an acute hospitalization for some acute issue, like you're just stressed out, overwhelmed, you're not thinking often straight, and like then trying to make all these other decisions, it just becomes very overwhelming.
Absolutely. Liz, I think you had another question. So no, you're good.
No, I'm good. Sorry. No, I was just scratching my head.
Okay. All right. So I have another question that came from the group that I've been talking to, and that is really around timing and when to engage someone like you, Angie. So many people, families only think to reach out during a medical crisis, right? but you're often involved much earlier. When's the right time to bring in an advocate? And can you talk about the moments before something urgent like advanced care planning or long-term care planning comes into motion, and when an advocate can be especially helpful?
Yeah, I mean, I think really a lot of it does center not only around that kind of planning that we were talking about most recently about just now about assisted livings or other planning like that, but advanced care planning is huge. We as a society do not like to think about death. We don't like to plan for death. And so an advocate can help to make sure that all of your healthcare power of attorney, your living will, whatever mechanism you want to use to make sure that your wishes are understood and then honored when that time comes is very important. And I also think that the advocate, like, so when I would engage with someone in advanced care planning, part of my job, I see it as, okay, let me talk to you about what you want for your end of life care and end of life decisions and what your goals of care are. But a lot of it is translating that and making sure that if you designate someone as your healthcare proxy, that they understand that and that they understand their role. I had a client once who she had no children. She actually cared for her husband who was older than her. They were both in their 90s. She had two healthcare powers of attorney actually, and one of them was the financial power of attorney as well. That individual thought that the financial power of attorney came into play when my client passed away. And I think she thought of it more as being an executor of an estate than a financial power of attorney. And so a lot of this is, how do we have the discussions that can be challenging to have to make sure that you get the care that you want? But then how do we make sure that the people in your ecosystem and the people that you've designated to make those decisions understand your decisions and feel comfortable carrying them out when that time comes?
So helpful. Rukmini, I think you had a question.
Yeah, and this was perfect segue because it's related to this kind of a situation. What's in my head is the family dynamic, and your allegiance clearly is to the client. So does it stop if and when a client passes, or do you continue to help with the execution of anything? That's one. The other is, what happens if the family starts to disagree in an acute situation, which I've heard so many stories about that. Do you actually get in there? Are you representing the client at that point? What happens? And then the third is, so your allegiance is to the client, but they do have a power of attorney or health proxy. What happens in that case? So it's basically dynamics, family dynamics, and what's the role you play?
Yeah, for sure. So my while yes, my allegiance is to the client, it doesn't necessarily stop when they pass. Like, so for example, my very first client that I signed on passed away. And I'm still helping her husband kind of go through medical bills because like those take time to go through, and it's not going to be done on the day that she passes away. So it's still, all of the work is still related to something with that client. If he asked me something for him personally, I would sign a new agreement with him. The family dynamic thing, so I have not had this this happen fortunately with a client, but I think that's where I actually bring a different and unique skill set to patient advocacy, because I dealt with this unfortunately a lot as an ICU physician. And having someone who couldn't speak for themselves have two sets of children who don't agree, and it's really then, in my mind, that's when the conversation and facilitation skills come in. And if I were to have that happen to me, it's always going back to, okay, what would mom want? What would dad want? Like, And as a physician, when I had these conversations, and I would imagine that I would handle it relatively similar as an advocate, it's, you know, hopefully we've had the discussion of what mom feels a good quality of life is before she got sick, right?
Yeah.
If we didn't, what do we think is a good quality of life that mom would want? And then are the things that we're doing often, you know, in the hospital, or the different tests or procedures or whatever, are those things, does their healthcare team think that those things are going to get them to that quality of life that they want? And would they want to go through all those things? Because even if they can get you to that quality of life, if it's going to take you a year, and if you're going to have to go, you know, I mean, we have some people who, like, they do not want to live in a skilled nursing facility. Well, then, okay, if they don't want to do that, then how are we going to set up things around them to try to keep them safe? And especially if they still have capacity to make, I mean, people can make their decisions for themselves, and we don't always have to or can, like, agree with those decisions. And that it's hard. It's hard.
Yeah, no, but thank you. I think what I've mainly heard from you is you don't say that's not me, I can't help, because it's a family
Right.
dynamic.
Oh yeah, no. And hopefully, you know, through the process of working with them, I have, I would say it's, well, I wouldn't say, yeah, I would say it's relatively rare. I have one client where she's married and I've never met her husband, but I mean, even for my client who's in his 30s, his wife comes in on our calls together. So usually when I'm engaged with a client, I also have the fortune to also engage with their family, or whatever their care team, their care support system looks like. And so hopefully I can also facilitate those discussions before it comes to a crisis point.
I would just say thank you, Angie. This was truly wonderful. I think that everyone would agree with that. And thank you for spending this time with us today, this afternoon, when you could be outside playing in this glorious sunshine we have here in Madison. But I know some folks might be cloudy, but we're happy that you spent the time with us. So this series is part of how we're building CuroNow with caregivers, not just for caregivers. We'll share the recording and a short recap and a couple next steps. If you haven't done it already for our early community, download the CuroNow app. If you haven't already, invite a sibling or trusted family member to join you. It's designed to be used together, and send us your feedback on what you want to see in the next session. Some of our users are super users and give us feedback every day, and I'm looking at one of them right now. So we are so grateful you're on the journey with us. Thank you again for being part of our early CureNow community, and we'll see you very soon. So thank you so much, Angie.
Thank you.
Thank you. Thanks
Really
so much for having
appreciate
me.
it.
I loved being here. So
Excellent.